Hi, I'm Dr. Brad Shook. I'm a board-certified chiropractic physician in Hickory, North Carolina at Hickory Spine, and today I want to talk to you about how to diagnose a whiplash injury. I'm going to go ahead and say from the beginning, I'm not a huge fan of the whiplash diagnosis because it's a non-specific diagnosis of muscle soreness after typically the spine, the cervical, or the neck after a motor vehicle collision or a car accident, car wreck. Okay, so I don't like it because it doesn't specify what has actually happened. It just says, hey, you hurt and your neck hurts, and it's from your head whipping around. Okay, but is that bad or not, or is it just something that everybody it's all the same for every person and everyone gets better from it? I think you understand that that's not the case. Everyone does not get better from whiplash. There are different degrees of whiplash. So what is a whiplash? Well, whiplash is most commonly injury to the muscles of the neck, the ligaments that hold the bones together, the nerves that leave the spine and go into the arms, and also the bones. The bones can be fractured. So whiplash can damage any of the tissues. I mean, you actually have vessels that can be damaged, but that's a lot less common. Most common that you tear the muscles and you tear the ligaments, and you can have damage of the disc that spaces the bones. It can cause herniations. It can cause nerve damage. So it can create a lot of different problems. So, whiplash in general, I don't like it as a diagnosis because it's not specific enough. If you don't have a specific diagnosis, how can you properly help the person to get better? So that's one of my things, that I like to get really specific as to what has happened. And so I don't like diagnosis of whiplash as a diagnosis, but typically if you have pain and soreness after a motor vehicle collision, you have some restricted range of motion, you can be diagnosed with a whiplash. And that's really how it gets diagnosed. It's pretty simple. It's primarily based on symptoms. The thing is that's not good enough, quite frankly. It's okay, but you need to know what's going on because there are different degrees of ligament tears in the spine, which can create major problems in the future. And if you just tell everybody that comes in with a whiplash, you just have whiplash, it'll be better in 5 or 10 days or whatnot, then that's not really accurate. Their pain might come down, but if they have severe ligament tears, which is a permanent injury to the spine that will cause arthritis and a lot of problems in the future, then you've just misled that person and they think when the pain's gone that they're better. And that's not the reality of the situation. The reality of the situation is that it's a permanent injury if the ligaments have been torn. You have to measure the ligamentous tearing. You have to utilize special x-rays. That is what the American Medical Association guidelines to impairment tell us how to do it. And you have to use specialized software that all of the spinal and biomechanics, how the body works, how it's being measured in the newest scientific literature, in the newest university studies. They're using computerized programs that can be extremely precise. That's what we do in our clinic. That's what you have to do if you really want to know what's going on with the ligaments of the spine. Now, obviously, if there are other signs or symptoms, like nerve signs, then you have to get the nerves evaluated. Maybe you need an MRI. There's a lot of things that need to be considered. I don't like whiplash. It's too general of a diagnosis. It doesn't allow you to truly help that person as good as you should. I think that there needs to be a high standard of what needs to be done to help that person determine how they're going to do in the short and long term. How do you help them get out of pain? Can you help them long term? The therapy that you do today for their injuries is going to really, if they have a severe ligament tear, they need a very specific types of therapy. They don't need to just go home and take pain medications and forget it all like it's not an issue. But if you don't do the workup, you'll never know. And then you predispose someone to having lifelong pain and problems. So, yeah, that's one of my kind of pet peeves. It's like if someone's been injured, they have a whiplash injury, do the right workup, figure out what's going on, and help them to really get back, get out of pain, get their function back, and help them to try to have a better quality of life long term. And I know no one does this intentionally, right? None of your doctors or the providers that you see intentionally don't do the type of workups that I'm discussing here, I'm mentioning here. What they do is they do what they've always done, and what they're doing is not wrong, but there's a better way that I think needs to become the standard, like what is expected and what has to be done in order to for the person and their workup for whiplash injuries to be considered acceptable. right? There's just, we need to have a higher standard. Too many people are having long-term problems, spinal arthritis, and a lot of pain afterwards and after whiplash injury. And and they don't realize that it's actually from the accident that occurred that caused permanent damage to their spine and the ligaments that keep the bones together. So you got to do the right kind of workup, and I think it's really important when we're talking about diagnosing a whiplash injury that there's a better way, and I think that's what we really need to do. But anyway, I'm Dr. Shook. If you'd like my opinion on your case, I'd be happy to give it to you. And all you have to do is just give us a call, and my staff will be happy to help you with everything and help you find an appointment that's convenient for you. Our phone number is 828-324-0800. You can also go to hickoryspine.com to learn more about what we do in our clinic. But anyway, I hope this has helped you out today, and I hope you have a wonderful, wonderful day. Thanks.